Dr. Horatio Capote. I'm the medical director of the Division of Neuropsychiatry at Dent Neurologic Institute. I'm a neuropsychiatrist, and I also have another specialty in addiction medicine. At Dent Neurologic Institute, we treat patients who have a wide variety of conditions in their central nervous system. And then, part of what we do is educate the patient. Hey, this is an expected problem with this condition. It's part of your condition, but we can study it, do some studies, understand what's going on, and treat it. I like to think that because of all of our different focuses at the Dent, we actually have a more complete, holistic approach. For instance, we understand that there are multiple risk factors for people. For instance, people with bipolar disorder, 65% at some point in their life will also have a comorbid substance abuse problem. It's very common that people will try to self-medicate. They'll try to use alcohol, drugs, substances to change that experience that they're having. We understand that addiction is also a brain disease. It happens to everyone. It doesn't discriminate in any way. And so we deal with it, in an appropriate and helpful way, without being confrontational and stigmatizing. And that's our basic message, that many of these problems are brain diseases, and we're very well situated to understand the brain and work with it. We've been around since 1963. We have a long tradition of being contributors on a national and international stage to the understanding of neuroscience. We're now America's largest neuroscience group, and we're proud of our Western New York heritage and roots, and want to contribute to this community. So I think that's actually at the root of this very fruitful and helpful relationship between the Dent Neurologic Institute and G-Bound. Both groups very deeply rooted in the Western New York community, both collaborative with each other. And honestly, a lot of us physicians in both groups, having had relationships that span back, several decades. So we've known each other, we're friends, we work with each other, and we find ways that we can both help our group of patients